Registered Nurses and Midwives Association is growing increasingly frustrated over the government's failure to implement their conditions of service. At a press conference in Accra, the group's leadership warned that if their demands are not met, there will be serious consequences.
The strike was suspended in good faith, and we expect nothing less than a reciprocity of same. The rescheduling of the meeting, in our view, is in bad faith, since it may further delay the implementation of the agreed items.
The nurses had gone on strike to protest unresolved issues, including uniform allowance, research support, and other welfare demands. Although the Health Committee of Parliament intervened and the strike was suspended, the follow-up meeting to continue negotiations was postponed. Mark Kurt Nawani is the chairman for Parliament's Committee on Health.
The demands of the nurses have been converted into monetary terms, and there's a need for a preliminary meeting between the Ministry of Health, the Health Committee, and the Ministry of Finance to discuss the outcome of the analysis. However, the Minister of Health and the Minister of Finance, they are unavoidably absent from the jurisdiction.
The Ghana Registered Nurses and Midwives Association isn't convinced that the government is taking their demands seriously. Its leadership has warned that if there's no action by the end of July, the consequences could be serious.
We demand the implementation of the 4 agreed items not later than July 2025. This is non-negotiable, and we shall advise ourselves if any attempt is made to further delay the implementation.
With a deadline of July 31st, the pressure is mounting. The Health Committee is appealing for calm, but the tension in the healthcare system is rising again. The Ghana Registered Nurses and Midwives Association's patience is wearing thin, and it remains to be seen whether the government can meet the nurses' demands before the deadline.